and welcome to this week's episode of the UHSussex Preceptorship podcast. I'm Harry.
I'm Gemma,
and we're your hosts.
So last week we spoke with Rebecca about paediatric preceptorship at the Alex.
Yeah.
Today we're going to talk about paediatric and neonatal preceptorship across the whole trust.
Mm-hmm.
So I've got some lovely guests with us today to talk about that. Are you happy guys to just introduce yourself, your job titles, where you kind of work?
So I'm Sadie and I'm a clinical lead for education and practice development for paediatrics and neonates across all of our sites.
I'm Rachel, I'm the practice educator at the Trevor Man Baby Unit in Brighton and at Princess Royal in Painsea.
And I'm Tracy and I'm also a practice educator for Trevor Man Baby Unit at Brighton and a special care unit at Princess Royal.
Lovely. There's a lot of names of hospitals
Yeah.
in those job titles, isn't it? And thank you guys so much for joining us today. Last week we learned a bit about preceptorship at the Alex, but would you guys just be happy to talk about preceptorship sort of from that wider perspective?
Yeah.
Sadie?
Yeah, so we kind of look after two specialities, one being paediatrics and one being neonates. And the fun part is the geography of our trust, going all the way from Brighton to Chichester. Means we actually sit in multiple paediatric and multiple neonatal networks. So the Alex and Princess Royal sit under South Thames Paediatric Network, and Worthing and Chichester sit under Thames Valley and Wessex.
Mm-hmm.
And then from a neonatal point of view, Trevor Man, Princess Royal and Worthing sit under what we call Kent, Surrey and Sussex neonatal network, and then Chichester sits under Thames Valley and Wessex. So there's a fair bit of juggling going on with regards to networks. Therefore, preceptorship has to be kind of different as well, because when we kind of teach preceptorship, we want it to be based on local guidelines, but also based on regional network guidelines.
I'm just in awe. I have to remember.
That's enough, isn't it?
It's remembering everyone's names is my biggest thing.
That's so true.
That's what I do.
You've got it written down on Facebook.
So that does mean that we have different provision for different areas. So the critical thing is that everybody across paediatrics and neonates gets a preceptorship.
Yeah.
That's our key important thing. They get a year of preceptorship and that protected time, that nurturing, that community of practice. It just looks slightly different depending on where you are.
Yeah.
So our Chichester paediatric teams go under Thames Valley and Wessex preceptorships. So that's quite interesting in itself, that it's a regional preceptorship and run by the network. So it's supported by tertiary hospitals, but also it's a lovely community of DGH nurses.
Nice.
And also the faculty is therefore supported not only by the network, but also by PEER, which is for Paediatric Innovation, Education and Research. So they get a really interesting preceptorship with a lot of variety, enable a lovely community of practice across multiple hospitals. Yeah. And then we support that locally in-house with kind of in-house teaching and skills and drills on the wards and how we support that within our in-house education programme. Worthing are also part of that from paediatrics, and then obviously the Alex have a wonderful programme which you learned more about last week.
Brilliant.
Neonates, St Richard's also go under a regional programme for preceptorship, and the TMBE team have a wonderful preceptorship programme which they're going to tell you more about later.
Brilliant. Thank you.
Yeah, thank you very much.
Yeah. So guys, you guys both work in neonates, so your patients are very little. Do you have to be paediatric trained to work in your areas? We don't know anything about neonates. We're just very excited to have you and learn.
No, you actually don't have to be a paediatric nurse to work in neonates. So we welcome anyone who's a midwife, an adult nurse, a paediatric nurse, and we provide specialist training when you join neonates to help you get used to the speciality. So we welcome people from all specialities.
Brilliant. And your preceptorship, I would guess, is the foundation of that sort of start into that journey, I guess. No way?
Absolutely.
Yes, it is. You can go on to do the neonatal work-based learning module without actually having done it, but it is a much better idea to have done it first and for that preparation. I mean, we've been running the preceptorship programme in Brighton for a few years now, but initially it was just for newly qualified nurses. But now, of course, we're now including newly qualified nurses, people that are new to speciality, so as you said, can come from other areas, be an adult nurse and suddenly decide they interested in neonates and come and do neonates instead. And recently, obviously, we've taken on a lot more international nurses as well.
Yeah.
And same with nursing associates, again, a relatively new role. So we are now incorporating them into our preceptorship program as well. So for all of them, the preceptorship program gives them a good grounding in neonates, and then helps them then to make that decision if work-based learning is what they want to go on and do.
That's quite similar with our adult nurses, isn't it? The same sort of group
It's
of.
interesting to know though that you don't have to be a paediatric nurse.
Yeah.
It's really interesting.
Harriet, we're always
advocating
advocating stuff.
Might try that out.
No. Do you so your preceptees, do they have preceptors allocated?
Yes, they are. Well, at Trevor Manor and at Princess Royal, they're allocated a preceptor for their first year who will support them. I'm sure it's the same.
Yeah, same across the other hospitals.
So what I was going to ask is, what do you like about your job? What do you think is the most rewarding thing for you with working with all our units?
I always say that I've got the best job in the NHS because my job is literally all about better and literally about, whether or not we make the education better, whether or not we make the structure and the system better, or whether or not we just make today better for that nurse or that newly qualified, or if we just kind of answer a question they've been kind of thinking about for a while and just make them feel a bit better. So my favourite thing about my job is about better, whether that's massive kind of strategic planning about how do we make sure we've got education today and also in a year's time, 2 years' time, 5 years' time, and how do we keep making that incrementally better, but also how do we make our nurses' days better. And I say, hopefully a large proportion of my job is education, but also a huge proportion of my job is pastoral care of the teams, which is so important, especially for our newly qualified and our new to specialities, to make sure. They quite often feel they should know things because they've been qualified for a while, and actually reassuring them that you've come to a whole new speciality, let's help you with that. That's my favourite thing. How about you guys?
I just really love giving them that support. Really, I guess other people probably feel the same way. You can think back to how you felt when you first started, and you just want that person that you feel you can go to and talk to. I think there's obviously always a lot of personalities on the unit, and some people you will gel with and other people you won't. And I think when we do the preceptorship days, they get to know us as probably ordinary people. Yes, we're educators and we're band 7s and we're more senior than they are, but our preceptorship days are really informal, and it's just nice. We feel they can come to us, and they do on the unit. We're people they can come to with any issues that they've got, and I think they feel that they can talk to us about anything really. And it's really nice to be able to see that.
Yeah, having that culture is so important.
Definitely. It would be hard to say what I particularly love about the job. I think what first brought me to education was just working with people, and I just love, working alongside, whether they're students newly qualified or new speciality, or just working alongside people, and actually, like Sadie said, even if you just make their day better. Sometimes they might have been on the unit for a few weeks, and there'll be things that they feel like they can't ask because they feel like they should know. And when they work with us, I make sure I say, there's no question that's silly, so please ask. And the relief that they feel like they can just ask anything at all. And as you go along, you can just talk through everything. And I think it's nice to see them, like, their confidence grow throughout the day as they're like learning new things. I think that's just, And the preceptorship's great. I loved doing the preceptorship.
I don't think I've ever met an educator that doesn't say there's no such thing as a silly question. And
It's
really important,
good to know,
isn't it? Yeah. Just to finish, what would be your one bit of advice to that new person, day one, starting new in your speciality?
My thing is always if you think it, say it. One, from a patient safety and advocacy point of view, but I think also that kind of, if you're saying something, probably the rest of the room is thinking it, and that could be from the care of an acute patient all the way through to a staff team building thing. I think, and we need to give people the confidence and the autonomy to say what they're thinking. And I think, if you're thinking it, say it. And for us who are established and in place, is give people that environment where they can say what they're thinking. And
Really good bit.
yeah, that'd be mine.
Enjoy it. It's a great speciality to come into, and we're very privileged in the job that we have and the people that we work with, the babies and their families. I'd say, and trust your judgment, because a lot of new people, because there's so many different people, well, especially at Trevor we've got a huge team and everyone does things slightly differently. And I think people takes a bit of a while to get their confidence up, because everyone might tell them how to do something and then they do it that way, and then they might think the next day someone will say, oh no, you're doing that wrong. So my advice is trust your judgment. If you're following the guidelines and doing things safely, then what you're doing is good.
Yeah.
So, not to worry about everyone else's different opinions.
Not comparing yourself to
not
other
comparing
people is
yourself.
really
You're
important.
all on your own journey, and you all get to the same destination, but in different ways. So just, you'll
Enjoy the ride.
Yeah, enjoy the ride.
Embrace it,
It's a ride.
Never be too hard on yourself. Really, we all get difficult days, and like we were saying, that there's never a wrong question. You can ask as many questions as you want, and always feel that you can do that. But as I say, don't be too hard on yourself every day. Really, there is lots to learn. It's a really big speciality. I always say to them, I literally do learn something new every day. As long as I've been in neonates, 20 years or more, there is always something every day, something that's new even for me. So it's fine. And just ask lots of questions. It doesn't matter who
Even
you
the
ask
parents
for.
love being asked, don't they?
Yeah, parents
they're the centre of that child's
absolutely.
care. So they they often don't mind being asked questions about their baby.
Definitely. That authenticity of what you don't know is so important, isn't it?
Absolutely.
Thank you.
Thanks for having us.
Thanks for coming.
We will see you guys
Next time. Bye. Let's have a wave.
Yeah, bye.